600,000 Oklahomans are on Medicare, and it's time for them to review their prescription drug plan for 2017 because their current plans might not be their best choice. Here with us to talk about open enrollment and what you need to know is Ray Walker from the Medicare Assistance Program. Thank you so much for being with us here today.
Thank you.
So we do know that plan costs and benefits can really change from year to year. Can you first start off by just telling us what goes into those changes and why there's so much flux?
Like everything else with healthcare, the cost for Medicare also adjusts every year. And we've already received word that the Medicare Part B monthly premium is going to go up for next year. It was $121.80 for the new people last year. This year, the new people are going to pay $134. Now, the people that are already on Medicare and have been for a couple of years, they're going to keep paying $104 to $109 a month, but it's still gone up. So we want to help those people understand what are their options related to Medicare and what are the changes that they can make that'll save them some money for next year or give them better drug coverage. So there are these Part D prescription drug plans. These are companies that are contracted with Medicare. There's 20 different options that are available for next year.
Wow.
And the monthly premiums are different, the co-pays that they pay. Also, the prescriptions that every senior takes is completely different. So what my staff tries to do is we sit down with those people, we look at the drugs they take, we look at the pharmacies that they like to use, we try to get them matched up with the plan that's going to cost them the least amount of money for the coming year, as well as give them the best possible drug coverage.
Okay, so looking to 2017, what's the average cost it's going to take someone to be covered by Medicare?
The average cost for someone, as I said, you've got the $134 a month, but most of them are going to pay $109 for their health care. Part A covers them when they're inpatient, Part B covers them when they're outpatient, but it doesn't touch the drug coverage. The drug plans range in cost anywhere from $17 a month up to like $160 a month. Now that plan that's $160 a month, it covers some very high cost drugs. So that's why we try to match them up based on their health. If you're a relatively healthy person and you don't take very many prescriptions, you're probably fine with that $17 plan. But if you've got some prescriptions that are a little more costly, you want to make sure the plan that you enroll in covers those drugs.
In this open enrollment period, are people required to update a plan for 2017, or is this just y'all sit with somebody and you review to make sure that the option that they have is the best one for them and their family?
Exactly. It's completely their choice.
Okay.
If someone sits down with us and we do a review, they have the option of changing or not. But it's always nice to know going into the new year whether or not you can save some money. We've had people that have saved $5,000, $10,000, even $15,000 for 2017 by reviewing their drug coverage.
Yeah, and I think I had read a release from you that said one woman even saved some $33,000.
Exactly.
I mean, if you're smart about this and really take advantage of the help that you have.
Pharmaceutical costs are outrageous.
It can be a game changer.
They're so expensive, and seniors are particularly vulnerable because most of them are on a fixed income. So this is a great way for them to make sure that they are set for the new year.
And I know Medicare is for people who are 65 and older, but kind of on the same note, with a lot of changes around the corner, is going to be Obamacare. I mean, next year, Blue Cross Blue Shield will be the only provider for Obamacare, and I think in some instances it's going up some 76%.
That's correct.
What's your response to that? And to people who are saying, how do you even afford to live these days?
Exactly, and we're going to see some changes this year in the political climate related to that, so everything's kind of up in the air right now. We don't want to make any sudden changes that are going to cause anyone to lose insurance, but it's going to be a shift. Now, for people who are on Medicare, we've got lots of those people that are transitioning into Medicare from the marketplace plans, and we try to educate them on what are the changes they need to make, because once someone qualifies for Medicare, they no longer qualify for the tax credits that they received during the time they were on the marketplace plans.
And I know the day after Trump won the election, the traffic on healthcare.gov was just astronomical. I mean, 100,000 people signed up for Obamacare that day. What happens to Obamacare for Oklahomans who have it? If, Trump is to come to the Oval Office and repeal Obamacare, what happens to Oklahomans who are now under that plan?
That's the question that's on everybody's mind right now, is what's going to happen? What are the alternatives? I think at this point in time, the odds of them just completely and totally doing away with the current Affordable Care Act marketplace plans are probably not going to happen. We're going to have something that's going to be some kind of a transition for those people who took out those marketplace plans and have been using them to access health care during this time period.
Okay, so no word yet on whether or not somebody can be grandfathered in or something like that?
Nothing yet.
Okay, and so we know this open enrollment for Medicare is going to be October 15th, so it's already started through December 7th.
That's correct.
Are you locked out, of changing a plan after that December 7th
For
date?
the most part, if you don't
Okay.
get your changes made by then you're stuck with whatever you've got until the following year. There are some circumstances that it can occur in the middle of the year that would allow someone a special enrollment period, but by and large, you really got to get that made by December 7th so that those plans are effective January 1.
Okay, and I know you wanted to share a phone number and just tell people, you know, if they need help, they need Medicare assistance, what's the easiest way to do that?
The best way to do this, call us 1-800-763-2828. There's someone that answers that phone 24 hours a day, 7 days a week. We also contract with a number of the area agencies on aging and some of the community action agencies around the state as well. So if they'd like to talk to someone in their local area, just give us a call and we can point them in the right direction.
Okay, Ray Walker with the Medicare Assistance Program, I should say. Thank you for stopping by.
Thank you.
We know your department must be crazy
Very.
right now. Yes. Thank you.